All right. Hello, everyone. Welcome to It's Worth a Shot for December 13th. I'm really excited today for our presentations. We will be talking about holiday happiness, and then we are going to talk about some Project Firstline updates. Let's go ahead and go to the next slide. This is just our quick disclaimer. Our presentations today are brought to you by Mountain Pacific, so we do not have any third parties presenting any content today. Let's go ahead and go to the next slide. Just as a reminder, we will not have It's Worth a Shot on December 27th, just taking a little pause for the holiday. So we hope you guys all enjoy your time with your friends and family celebrating. Then we wanted to share some new quality assurance. I shouldn't say new, some new and updated quality assurance and QAPI resources. So Miranda will drop that in the chat, or she will send that out with the notes for next week. So some really great resources there. So make sure you guys take a look at that. And especially as we start the new year and we're updating our QAPI plans and whatnot, it's a good resource. Let's go ahead and go to the next slide. So just as a reminder, we appreciate you guys' input on what topics you would like to see each week. So make sure you guys add those either at the end with the evaluation or drop it in the chat. Again, we value you guys' input on that. And then we have a couple of polling questions today. So let's go ahead and do our first polling question. Okay, this is a true or false one. We're going to test your knowledge. So it is against the law to deny admission for patients, residents based upon opioid use disorder medication use. Absolutely. A couple more. Okay. Most are in agreement. Let's go ahead and, oh, still some answers coming in. Maybe some changed answers. Okay, let's go ahead and end that poll. You can share those results. So 93% of you guys believe that that is true, and that is true. Let's go ahead and go to the second question. The DEA data waiver is required to subscribe Suboxone. Let's test your knowledge here, everyone. All right, and I just realized that there was a typo in that. That should have said prescribe, not subscribe. And let's go ahead and end the poll. So 77% of you guys say that that is true. And Kyla, I'll let you chime in if there's any questions that come up about this. But that was an original requirement, and now it is no longer required. So if you guys have questions about that, we can do some additional follow-up in our questions for next week. If you guys, we can make sure we provide some additional information on that.
Yeah, I can add to that a little bit, Callie. So they removed the requirement to have that XDEA number, and also the limit on the number of patients that you could treat. There used to be limits, and then you would have to renew that specific DEA number every year. But now any prescriber can actually prescribe Suboxone for opioid use disorder. So I will throw in the chat the FDA kind of alert about that, but thank you.
Thank you, Kyla. I appreciate that. We will make sure that we throw that into next week. So you guys also, we make sure you guys all get that. So let's go ahead and share those results and end that poll. And then we can move on to the next slide and we'll do some weekly influenza updates. There we go. All right, as you can see, and I'm sure most of you guys are experiencing this in your communities, but influenza is on the rise. It looks like Montana is doing really well. I am here in Wyoming and we are definitely experiencing some influenza outbreaks in our communities. Alaska is on the lower end as well, and Hawaii is in the green. So you guys are doing well. Don't come to Wyoming right now. Bad time to visit. Let's go ahead and go to the next slide. And unfortunately, COVID is on the rise, and this is kind of across the board for our communities. I think every time there's substantial decrease in some communities and substantial increase in others. So, but unfortunately, we are trending up in hospital admissions, deaths, and ED visits. So, all right, let's go ahead and go to the next slide. And I would like to welcome Alani Silva. She is with Mountain Pacific and she is going to present on happy residents and healthier lives.
Hi. Okay, there we go. I needed to unmute. Hi, everyone. My name is Alani Silva. I'm an account manager at Mountain Pacific in Honolulu, Hawaii. So today we're going to be talking about our nursing home, assisted living residents who are in care situations and why happiness is so important to them. Next slide, please. So as we know, I mean, with what we deal with every single day, we have a very large senior population that's only getting bigger. Seniors account for about 13% of our United States population out of the 300 plus million Americans. That's how many we are looking at currently over the age of 65, and that number is growing. According to US News and World Report, there's about 1.5 million people currently in home care settings, but that's the Medicare and Medicaid certified nursing homes. So as we all know, there's a lot more maybe other types of settings that don't show up in this number. So that's a much larger number, and it's expected to double by the year 2050. So given where we are now, we're looking at a very large population of elderly people needing assistance with their day-to-day activities. Administration on Aging states that about 20% of these people in this age demographic, they're going to be needing that care longer than 5 years. So while we hope that we can keep our loved ones at home, especially in a community here like we are in Hawaii, we have a lot of multi-generational households, and they, never want to send their loved one away. But the reality is this may be something that not only is essential, but could be for the longer term, given that their years of life expectancy are longer. This could be looking at a 5-year plus time frame. So what do we do with them while they're in our facilities? How do we engage these residents, not just provide shelter and medical care, but really increase their quality of life? Next slide, please. So the rates of depression. Oh wait, was there one before this? Sorry, Mary, is there one? Was this the next slide? Just checking.
Yes, this is the next
Okay, okay, sorry. Yes, so in nursing homes, we want to make this a very positive type of environment, but they do show data that says about 50% of these residents out of the millions that are in these care settings, about half of them or more are showing signs of depression, which clinically qualify them as being depressed. Why is that important? Because not only is that not a great environment for them or anyone to come to, but it's also that when people are happier, their overall lives are better. What do we see with positive views? That people who are happier have a 19% lower mortality, that about 44% of them are more likely to recover from serious illness or disability. So if they're in a care setting, I mean, they've had a condition that has driven them there to need help, to need assistance, to need medical attention. But by increasing just the environment and their demeanor, their physical conditions improve. So not only having lower mortality, not having as much chronic debilitating diseases or them worsening, also decreasing dementia by 50%. So we all know aging populations have a higher risk of dementia. By keeping them engaged, positive, happier, joyful, their dementia risks also go down because they are actively engaged with their community, finding pleasure in day-to-day activities. Next slide, please. How do they find this happiness? What is going to bring them this joy? What are areas of joy that we can foster for these members of our community in the nursing home settings? Basically, these topics here will tell you that purpose, experiencing joy, being engaged, connection, social connections, staying active, physically fit, safety, independence, all these things are areas in which, when fostered, their overall happiness increases. Like purpose, giving them opportunities. Many times these seniors, they had very rich, vibrant lives, and if they're given opportunities to volunteer in their care homes, giving them tasks, even helping out with little things depending on their mobility, having a role, having a function, that gives them a sense of purpose. Experiencing joy, having ability to laugh, either if it's watching a show or anything that brings them humor and joy, to experience the feeling of happiness. Keeping them engaged physically and mentally with activities, but things that spark interest with them that they are going to have to participate in, connection to others around them, forming new friendships, whether that be with staff or other residents, having shared activities. It alleviates loneliness and it brings them a sense of belonging. Physically active, depending on level of mobility, having activities that are centered towards some even chair exercises for those who have a hard time getting up and down. But you see this picture here, these ladies are very vibrant and very able to get up and have connection and activity by being physically engaged. Always ensuring their safety, but sometimes it's even reported back that some facilities, maybe their safety measures may be overreaching. If that would cause the member to feel maybe restrained, or not having that independence that maybe they strive for. So safety is always first and foremost, but not over restraining the patient, so that they can still be active, they can still participate, and they don't feel as if they're confined or restricted. And having, like I said, that independence, allowing them to make these choices, asserting their personal preferences. So while, yes, they understand they can't be living at home, they need more care than they're able to get in their home setting, but having a sense of independence, that it is still their space, that they still have some autonomy on their life. This is a way that our senior patients can find the happiness that will overall contribute to their quality of life and for those around them. Next slide, please. This is just some pictures of staff members, and we all see this in our homes, actually sitting with them, listening to them, engaging, having activities with them that require them to think a little bit, and also having physical activities within their abilities. Some have more than others, but we do see that some of these people are coming in earlier with more mobility, and doing these daily activities with them, making sure there is a schedule for this, will keep them satisfied and happy to be in a setting that really does promote their well-being and take an interest in them personally. Next slide, please. So how does this happen, right? How and why? This happy staff creates happy environments. So the people who are in our facilities are the ones who are going to make sure that this sense of joy and purpose is fostered. We all know we're facing, everywhere we go to, facilities of all types have staffing issues, right? We are looking at people who maybe are still trying to staff completely. They're still short. They don't have enough staff. But the staff we do have, and hopefully hope to attract, We want to be fostering a team approach, keeping them engaged, avoiding burnout. A healthy and happy team will more likely provide this positive, optimal care that we're all striving for. So doing that means that the operators of any of these facilities, people who are leading these staff, need to invest in development, support your staff, have this safe, comfortable, joyful area to work in and live in, and being invested in your team will increase their morale, which in turn will increase the residents' morale, because you want to have happy staff who are feeling valued, who are feeling supported, they get the training they need, having ongoing updates, because we all know from the past few years, don't get used to the status quo. We can have things change on us. So staff that knows their leadership is investing in keeping them up to date, knowing what needs they have to support them, to balance their workloads, will ensure that the staff, when they come to take care of these residents, they will be prepared, they will be valued, they will be able to spread that joy and foster it within the whole environment, because that's truly where our key assets lie, with our staff, who then in turn take care of our residents. So with that, I think that is the conclusion of my presentation, but just one way to remember that while we have these festivities and these joyful areas of holiday celebrations, that we also need to make sure that we pay attention to our staff and residents to make sure that they are getting their needs met, and that we are always looking after these people to make sure that they will foster this in our patients, so that they will have the quality of life that they come to us for. By being a resident of these facilities, they know that their care is top notch, and they're probably extending the quality of their life, not just living out days in a facility that perhaps, you know, we all can understand there's a resistance to coming to a home by family members, but when they see what great care they're getting, what happiness and joy their loved one has by living there, it's a comfort to them to know that they're not able to care for them, but they're trusting the people who do. So with that, happy holidays, everyone.
Thank you so much, Alani.
You're welcome.
We will go ahead and transition now to cleaning and disinfection. Level up your disinfection game, and I'm going to turn it over to Crystal to present.
Okay, thank you, Callie. Hopefully all of you have heard of Project Firstline by now. In case that you haven't, or just as a refresher, Project Firstline is CDC's national infection prevention and control collaborative that we have been working alongside of the Wyoming Department of Health and our Hawaii Department of Health partners for a couple of years now, and we just keep getting better. So this is our latest interactive infection control gaming. So Mary, if you want to slide to the next one, please. Hopefully you all received this flyer. I do believe that it's out there and we want you to use it. So you can either get the game through the QR code or through the link. And basically we've turned a classic educational flyer into a video game. So I'm going to share my screen, Mary, if you don't mind. And I'm going to take you through what we did. So tell me when you can see my screen.
I can now.
Okay, so do you see the how to read a disinfectant label?
Yes.
Okay, so this is a flyer that that CDC created, and it's one of their newer, they call it microlearns. And basically, I want you to kind of pay attention to the picture, because instead of handing this flyer out to staff or you know, we gave several out at conferences, which, you know, may or may not get read. we wanted to create, I guess, a more impersonable or a more personable way to learn about reading an infection or reading a disinfectant label and cleaning and disinfecting the proper way. So just kind of take a quick snapshot of that in your mind because you're going to see it again. And now I'm going to demonstrate the game, which takes around 10 minutes. So it should take us right up to the hour, but we are going to work as a team. So I'm going to bring the game up and let me know it does have sound. So if you all would let me know that I have sound as well. So I'm going to share my screen again. It says I'm sharing sound.
We're seeing your email. There we go.
Hi there. I'm the Environmental Services Supervisor, Donna. We've been tasked with disinfecting this room. Since this is a really important job, we want to make sure that we do it correctly. So we're going to go through all the steps together to make sure it gets done right. First off, in which order should we perform these actions?
Crystal, if you're talking, we can't hear you. Crystal, if you want to play it, then I can go ahead and kind of help narrate it. And then I'm guessing you want us all to participate by guessing the questions. Okay, so if we want to take a vote, guys.
Miranda, I can jump in. I've gone through this with Crystal
great.
before, so I can help with that. So the first step, and you guys are welcome to come off mute and jump in, or if you guys want to drop it in the chat, whatever works best for you guys. So what we want our staff to do is we want them to pick what order they would start in. So what you'll do is okay, so Karen, she says to gather supplies. So that would be the first one. So there you go. So kind of walking through it. So before we gather supplies, there's a step that we need to do first. So let's revisit. Any other thoughts? Not seeing a lot of there you go. Ariel, good job. Let's wash hands. Ah. Okay, so noting the signage on the door. Let's go ahead and close that. Okay. So wash hands, note sign, gather supplies, and then don the PPE. So note the signage, then gather the supplies. Then we will wash our hands. And then last, we will don our PPE.
Great job. All right, we're ready to move on. Next, we need to note the signage on the door, then we can gather our supplies. This sign says contact precautions, which means we'll need to wear gloves and a gown. We'll want to remember this for later. This germrite has the right active ingredients to disinfect the room, but we need to make sure it's registered with the Environmental Protection Agency, or EPA, before we can use it. Do you know how to verify that we can use this product?
So on this, what would we be looking for? Again, you guys can call out or drop it in the chat. And this is interactive as well. So we will have Crystal click on the area. Okay, not seeing any responses. So this one is asking us to click on the EPA registration number.
Great. An EPA registration number means we can use this product to disinfect the room. But wait, there's something wrong with this bottle of germrite. We can't use this one. Do you see why?
There you go. Everyone's got it. It's expired. Good job, guys.
Good catch. This germrite is expired. Always refer to the manufacturer's label and your state's requirements for proper disposal of disinfectants.
Okay, so this part is helping guide us through how to dispose of the product properly. So in reviewing this, take a look at the storage and disposal and tell me which one to click on. So are we going to put it in the toilet? Are we going to put it in the garbage can? Are we going to put it in a biohazard bin? Or are we going to put it in the sink? Okay, all right, trash can it is. Good job, guys.
I'm back with our new bottle of germrite. I see you figured out how to correctly dispose of the old one. Now that we've got all of our supplies together, let's make sure that we have everything we need to use them. What else will we need before we start using this product?
Okay, so again, referring to the label, what PPE items would we need? And where would that be? Okay, so gloves and eye protection, and that is found under the precautionary statement.
You're right. We'll have to grab some eye protection and gloves before we use this product. We'll also want to make sure we know what to do in case we get it on our skin, clothes, or in our eyes. That information is displayed here. It all seems pretty cut and dry. What should we keep in mind while using this product?
So what are some things we would keep in mind? We would want to know where the eye wash station is. Okay, and if we get it in our eyes, how long to rinse our eyes for. Okay, we could also keep in mind the poison control number. And according to the label, does...
Great job.
Oh.
Now, we can't use this disinfectant for everything in the room. Where can we find what surfaces this product is safe to use on?
So under the organism section, you guys will see that it covers staph and Pseudomonas. You can go ahead and click on that under the directions for use. Oh, sorry. We were looking for
That's
the,
right. Now we know to only use this product on hard, non-porous surfaces. Now we'll want to make sure we understand the other directions for use, like how long the surface needs to stay wet, also called wet time, dwell time, or contact time. What is the contact time for this disinfectant?
nice. Good job, Miranda. 10 minutes. Good job, Wendy.
Now that we understand how to use this disinfectant correctly, we're finally ready to sanitize our hands, don our PPE, and get into the room. What PPE do we need to disinfect this room? Remember, the signage on the door said contact precautions, and the germ right also required some safety equipment.
Okay, gowns and gloves.
Good job. What else do we need? Good job. What else do we need?
Eye protection.
Wow, you're good at this. Now we just need to don our PPE and we're ready to get started. Now that we're wearing the necessary PPE, we're ready to clean the room. What surfaces in the room can we use this disinfectant on?
To remember your non-porous surfaces. So where would that be? Countertops?
Good job. What else can we use this disinfectant to clean?
How about the bed?
Good job. What else can we use this disinfectant to clean?
Light switch?
Good job. What else can we use this disinfectant to clean?
The chair was a question. Okay, so that's a porous chair. Window seal.
Sorry, Callie, but the game quit. So I don't know what happened, but we didn't get quite through it.
Okay. I'll let you go ahead and finish up.
Okay. Anyways, I realize we're over time, but we will share out this link. And if you want to, we were almost done with the game, and I do realize we're out of time. So I highly encourage you to go back through it and share this with your team alike. And always, if you have questions, holler out to the team here at Mount Pacific. I think I'm done. The slides do have the resources for Project Firstline, as well as downloading the video as well. So thank you, and apologies for my when I share my screen, my my speaking function goes away.
All right, we can go ahead and go to the next slide. And these are the links that Crystal was referring to. And let's go ahead and go to the next slide. We'll send all of the links out. Does anyone have any questions? I apologize on my one mix-up there on reading the label. But that is a really great, fun, interactive video. We were able to do it with some infection preventionists here in Wyoming and a couple of different times. And we've had some really great feedback. So it's a really good resource for your staff and services, just fun and engaging. So make sure you guys take a look at that. As always, please make sure you fill out the evaluation for It's Worth a Shot. Feel free to email Crystal if you guys have any questions about the video, or you guys can email myself. And I'm not seeing any questions. So thank you guys for joining us today, and join us next week for It's Worth a Shot on Wednesday. And again, our pause will be the following week. So we will see you next week. Thank you, everyone.
Thank you.